Hi everybody, this is Mrs. McDaniels, and we are going to talk a little bit about left-sided and right-sided heart failure. And this is just going to be a quick overview just to kind of help you have a better understanding. First things first, we really need to just do a quick review of blood flow as it comes into the heart. So remember, unoxygenated blood is going to return to the right side of the heart. So remember, return right side. It's going to come in through your superior and inferior vena caves. It's going to go into the right atrium through the tricuspid valve to the right ventricle. It'll be pushed up through the pulmonary valve here and through the pulmonary artery away from the heart to the lungs. And it's going to be here in the lungs that the unoxygenated blood will be oxygenated. Once it is oxygenated, it will return. So now it's O2 rich blood. Will return through the pulmonary vein into the left atrium through the mitral valve into the left ventricle, and then it will be pushed throughout the rest of the body. And that is pretty much the quick overview of how blood flows in the body. Now, with that in mind, when we start talking about problems with the heart in terms of failure, it's going to come down to perhaps some different components. The workhorse of the heart is this left side of the heart, and that's where we're going to talk about first, simply because that left side has to push against the resistance or the force of the rest of the body to basically try to get oxygenated blood all the way down to the far reaches of our body, which will be the extremities, lower and upper extremities of our body. Because of this extra work, depending on any other comorbidities in the body, it can lead to hypertrophy here of that left ventricle, especially if patients have some valvular issues. Valvular issues can lead to either regurgitation, or it's also known as insufficiency, or stenosis. Regurgitation, if you remember, as blood say would come back from the lungs into the right atrium. Regurgitation is basically as blood comes through here, the valve should close properly, but it doesn't, and a small amount goes back into the atrium, so the heart is having to work harder, which can lead to the hypertrophy, which makes it more difficult for it to pump blood out to the rest of the body. Or you can have issues like stenosis, where there's a narrowing and things just tend to build up because the opening in which the blood has to flow through is narrower. So with your left-sided heart failure, if you look over here to this graphic, it talks about the different signs and symptoms that a patient would have. And what you have to remember is that it will be primarily pulmonary because all that blood is getting backed up from the lungs. So you basically have this kind of holdup of what has returned from the right side, then pushed to the left side. And so that's why we'll have this paroxysmal nocturnal dyspnea, which is basically you wake up in the middle of the night and you're having difficulty breathing, pulmonary congestion, and this kind of ranges depending on the severity of the heart failure. And because of this, pulmonary congestion is going to lead to restlessness, confusion, orthopnea, that's basically shortness of breath when somebody lays flat. It will cause tachycardia because their heart's having to work harder. Exertional dyspnea, basically you're having more difficulty breathing, fatigue, and some cyanosis. And so that's going to be your left-sided heart failure. Now on the flip side, when we talk about right-sided heart failure, it's typically not as common, but there are going to be certain comorbidities that patients have that is going to increase their risk. And so you may also have heard the term cor pulmonale. So right-sided heart failure is also known as cor pulmonale, and that is typically when the root cause is from a respiratory condition. This could be exacerbated by COPD, embolism, a fibrosis of the lungs, sleep apnea, myasthenia gravis, and poliomyelitis, which ultimately this can lead to what you've probably have heard of pulmonary hypertension. And over time, because of these difficulties here, this is when you might have some right ventricular dilation and hypertrophy. So this side of the heart actually doesn't function as well. So when that happens, your signs and symptoms will be more systemic because that is the blood that's returning to the body. So you may see an increase in peripheral venous pressure, fatigue, ascites, which is buildup of fluid here in the abdominal cavity. Some patients will have enlarged liver and spleen. Again, it may be secondary to COPD, distended jugular veins, anorexia, and complaints of GI distress. People just do not feel hungry, weight gain, and of course, dependent edema. So that kind of gives you looking at the signs and symptoms and just some of the background to what causes the two different types of heart failures, and hopefully that just clears it up for you a little bit better. And if you need to look at some of the other cardiac overviews that I have, and hopefully it helps you along the way. Happy studying.